There are a few things that readily comes to mind when you are looking at undergoing a bariatric surgery, a weight loss procedure. Number one talks about safety or success of the surgery. Number two talks about complications, because we could have complications during surgery, in the immediate postoperative period, or later in future. Number three talks about the recovery process. Will it be smooth? Will it be challenging? And number four talks about the final outcome, the final results that you want. Are you going to achieve your desired results? Your LD weight, that slim body that you would want at the end of the day. In this video, I'm going to be talking about side effects and possible complications of undergoing a bariatric surgery. Let me not scare you. I called it side effects and possible complications. Side effects may be common, may be rare. Possible complications because it talks about risk of complication. Risk because it may happen, it may not happen. How do I mean? For example, moving from one place to the other on the road in a car, you are at risk of being involved in a road traffic incident or accident. Traveling from a town A to a city B, you are at risk of being involved in an accident. Does it mean you are going to be involved in an accident? No, 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 maybe yes. So you could journey on the same road from the same destination, taking off from the same town, going to the same city 100 times, and you are not involved in an accident at all, but the risk is there. And if an accident eventually happens, what does it mean? The impact may be mild, may be moderate, may be severe. So I'll be talking about side effects and possible complications of undergoing a bariatric surgery. If you are new to my channel, I implore you to click on the subscribe button. If you're a returning viewer that has not subscribed yet, I enjoin you, click on the subscribe button, turn on your notification bell, like this video, share it, make comments, ask your questions in the comment section. Let's talk about side effects and complications of a weight loss surgery. Number one, during surgery, there could be reaction or complications from anesthesia. These are not very common. You could react to anesthetic drugs, and there could be allergies to anesthetic drugs. But again, for every reaction to anesthesia, for every allergy to anesthetic drugs, there is usually an antidote. So this won't be a problem. Number two, complications could arise in the immediate post-operative period. As in every other surgery, infection is a possible complication. Infection and wound breakdown at the site of surgery, at the incision site. That is number one. Number two, because more often than not, they are major surgeries, there is a risk of formation of blood clots. Blood clots, which we call deep vein thrombosis. Deep vein thrombosis talks about clots in the deep veins of the leg. When it happens, there is a risk, there is a possibility of these clots being dislodged from the leg and traveling to distant part of the body. For example, clots from the deep veins of the leg can travel to the lungs, where it causes what we call pulmonary embolism, where respiration is compromised and it becomes a medical emergency. A weight loss surgeon would usually give medications or injections that would prevent this, but it is a possible complication. That is number two. Number three, you could come down with what we call anastomotic leakages. Big English, but very simple explanation to it. In gastric bypass, for example, the stomach, a good part of the stomach is taken away, leaving just a pouch at the top of the stomach, and the small intestine is brought and anastomosed. It is stitched, it is sutured, it is connected to that pouch at the upper part of the stomach. The site of the suturing, there could be some leaks there, there could be some gaping, some gaps there. Food substances, gastric enzymes, gastric juices, fluids may leak from these portions, and it could further progress to complications like peritonitis. But again, because it happens in the immediate postoperative period, if it happens at all, the surgeon is able to take care of it. Because in most cases of weight loss surgeries dealing with the stomach and the small intestine, what you take in becomes reduced eventually. What intake becomes reduced, you may suffer from dehydration in the immediate postoperative period. Food intake becomes reduced, As food intakes becomes reduced and the digestive system, especially the stomach and the first part of the small intestine becomes very, very compromised or reduced. Digestion, intake is reduced, digestion is compromised, nutrient absorption becomes altered or reduced or very, very compromised. So with that, essential nutrients like vitamin B12 that we need for DNA production, that we need for nerve functioning, that we need for red blood cell production, becomes reduced. There's a deficiency of that. For example, we could have a deficiency of iron in the body because of reduced intake in food. Iron is needed for hemoglobin formation. Hemoglobin is a core part of the red blood cell. This is used to transport oxygen from the lungs to every other tissue and cell of the body. Because of reduced intake, blood glucose may also be very low. But the good news is that this happens usually in the immediate post-op period when the patient is still in the hospital and the surgeon, the healthcare team knows what to do to prevent all of this. For nutritional deficiencies, there is usually a dietitian or a nutritionist on the team. So they will come in to help with your dietary plan after your procedure. They will come in to talk about what supplements you will need to take on the long run. That is number two, immediate post-operative period complications. We could have complications that borders on the gastrointestinal tract, gastrointestinal issues. We could have what we call the dumping syndrome. In dumping syndrome, you eat so little, a good part of the stomach is no longer there for food to settle, for digestion to continue, or to kick off, then absorption to start, and it goes into the small intestine. A good part of the stomach has been boycotted, has been compromised. So in dumping syndrome, you eat, it gets into the pouch or into the sleeve. It is not staying there for a long time. It goes almost directly, almost immediately into the remaining part of the bowel, into the remaining part of the small intestine. Symptoms from dumping syndrome commonly, we have nausea, we have vomiting, we have diarrhea, and the likes. From there, we could even have dizziness and sweating. Again, because you are not taking enough, we mentioned hypoglycemia earlier on, that's reduced blood glucose. Dumping syndrome would also lead to reduced blood glucose. Reduced blood glucose will lead to weakness, will lead to fatigue, will lead to sweating, may even lead to altered consciousness. Again, there could be constipation because the nutritionist have come in to alter the food you take. Again, because of reduced food intake, there could be complication. In the long run, there could also be peptic ulceration of the remaining part of the stomach or the upper part of the small intestine. Peptic ulcer disease could also be a complication in the gastrointestinal tract. Another common side effect is psychological downtime. We could have psychological effects, emotional imbalances. How does it come? When you start to lose weight, your body image becomes an issue. The body image becomes an issue. You are losing weight, you should be feeling good, but now you are having loose and saggy skin. You look at yourself in the mirror and you are like, wow, what is this? You could have mood swings from that. You could have depression from that. You could have anxiety, regret sometimes. Who sent me to do this? Why wouldn't I just continue with my diet, with my exercise regimen? You now remember again that you've tried to diet, you've tried strict exercise regimen, but it didn't work. At that point in time, you will need psychotherapy. You will need to consult your bariatric surgeon. You will need the help of family and loved ones to take you through this recovery period so that you don't continue to have mood swings. You don't continue, to be depressed and to be anxious. Another possible complication is the formation of gallstones. Research has shown that there's a correlation between an increased risk in the formation of gallstones and rapid weight loss because the body is not able to rapidly metabolize the fat cells that are breaking down at the speed at which it is broken down. So the liver is not capable at that speed, at that rate, to metabolize the fat. What eventually happens is that this patient comes down with gallstones. It's not only with weight loss surgery, with prolonged fasting, with starvation, with weight loss programs, non-surgical weight loss programs, solutions that people want to get to lose weight. When weight loss becomes very, very rapid, the liver may not be able to handle the metabolism, may not be able to produce what is necessary to metabolize the increased amount of fat that is being broken down by the body. The resultant effects with weight loss surgery, with all of the weight loss programs and regimen out there, is the increased risk of forming gallstones. And with gallstones, is either you are looking at surgery to take them out or strict medical protocols to help to take care of these gallstones. Also, there could be long-term complications following weight loss surgery. There could be long-term complications following weight loss surgery. There could be gastric stricture or bowel obstruction. It means there could be, in the long time, a narrowing of the stomach wall, a narrowing of the lumen of the intestine, so that it becomes so narrow and it becomes obstructed. Food will not be able to pass through. This usually may be taken care of medically, or it could necessitate surgical intervention. That is one. Number two, there could be development of hernias within the abdomen as a long-term complication. Number three, there could be development of peptic ulcer disease in the long term. These are some of the possible long-term complications that could arise from undergoing a bariatric surgery. Lastly, there is a need for lifestyle adjustment. And because this is not what you've been used to before surgery, it becomes some sort of complication, because you need strict new lifestyle adjustment to be able to have good success with your results and to be able to maintain overall good health condition. This will have to do with diet, we mentioned, dumping syndrome, we mentioned, nutritional deficiencies. You will need dietary modifications to maintain your results. You will need dietary modifications or even supplementation to stay in good condition of health. That's number one when we talk about lifestyle adjustment. Number two, you've lost weight. You will need some degree of strict exercise regimen to be able to maintain your health, to be able to maintain your weight. So you need dietary modification. You need to go back to some exercise regimen to be able to maintain your weight. And this will be for the long term, so that you can maintain weight, you can maintain your health. When we talk about lifestyle adjustment, another thing is that you are going to need for a long time regular follow-up care. Regular follow-up care. So your bariatric surgeon, your nutritionist would need to see you on a regular basis. It depends on what your recovery is. It depends on what your result is. It depends on your overall condition of health. They will need to see you on a regular basis, as is determined by them at the end of the day. These are the things, these are the complications you would need to consider to make an informed decision before going in for bariatric surgery. It's about your health. It's about losing that weight. It's about staying trim, or it's about becoming trim. It's about becoming slim and staying trim. It's about reversing obesity and its comorbidities, like hypertension, like type 2 diabetics, like sleep apnea, like snoring, even like the risk of coming down with certain cancers, like subfertility, like infertility, like impotence, and the likes. You need to stay healthy, so you need to lose that weight, but you need an informed decision before going in for that surgery. That is why this has come to your screen. If you've not subscribed to my channel at this point in time, I would implore you once again, subscribe to this channel and turn on your notification bell, so that as I upload new videos around weight loss surgery, around healthy living, around cosmetic surgery, you would not miss out on any of them. I would see you in the next video. Keep staying healthy.